While it might feel a little awkward to talk about, we need to have a chat about something really important: your poop. Yeah, you heard me right. When it comes to your health, the state of your poop can reveal a lot about what's happening inside your body. Think of it like this. Your digestive system is like a complex machine, and your poop is the final product. Just like a mechanic can tell a lot about a car's engine by looking at the exhaust, the appearance of your poop can give us valuable clues about your digestive health. So in this video, we're going to discuss 5 warning signs that might indicate your poop isn't as healthy as it should be, and why you should pay attention. Remember, I'm not trying to gross you out here, but to empower you to take control of your health. Alright, let's dive right in. One of the most alarming signs is spotting bright red blood in your stool, the toilet water, or on the toilet paper. Trust me, I know it can be scary, but don't panic just yet. Seeing bright red blood often means the bleeding is happening lower down in your digestive tract, like in the rectum or colon. Now, this could indicate a serious issue like colon cancer, which is a growing concern, especially among younger people. Colon cancer develops in the large bowel, and when a tumor is present, it can cause bleeding. As the stool passes by the tumor, it can scrape against it, leading to that visible blood you might see. However, and this is important to remember, blood in the stool isn't always cancer-related. Hemorrhoids, which are swollen veins in the rectal area, can also cause bright red blood. These often result from straining during bowel movements or can occur post-childbirth. Hemorrhoids are incredibly common, almost like a rite of passage for many, and while they can be uncomfortable, they're usually not serious. However, it's still essential to get checked out by a doctor if you're experiencing bleeding. They can determine the cause and recommend the appropriate treatment. Now back to colon cancer for a moment. I know it's a scary thought, but early detection is key. That's why it's so important to pay attention to your body and any changes in your bowel habits. If you see bright red blood, don't hesitate to consult with a healthcare provider. They may recommend a colonoscopy, which is a procedure to visually inspect the colon. It might sound intimidating, but it's a crucial tool for detecting and preventing colon cancer. They might also suggest a stool test, which checks for hidden blood that you might not be able to see with the naked eye. Remember, knowledge is power, and understanding what's going on inside your body is the first step to staying healthy. Now let's move on to another important indicator: changes in your stool caliber. What do I mean by that? Well, it's all about the shape and size of your poop. The normal shape of a stool is generally log-like, kind of like a soft sausage-like shape. But when it starts coming out in thin ribbons, or if you notice a significant and persistent change in its diameter, that could be a red flag. Why the sudden change in shape? Well, one possibility is an obstruction in your colon. This obstruction could be due to a growing mass, such as a tumor, that's narrowing the passageway. Think of it like squeezing toothpaste out of the tube. If the opening is narrowed, the toothpaste will come out thinner. Similarly, if there's a blockage in your colon, your stool might have to squeeze through, resulting in thinner stools. Now, I know this might sound alarming, but remember, not all changes in stool caliber are caused by something serious. Sometimes it could be due to something as simple as dehydration or a change in your diet. However, if you notice a persistent change in your stool caliber, especially if it's accompanied by other symptoms like abdominal pain, blood in your stool, or unexplained weight loss, it's crucial to get checked out by a doctor. They might suggest a colonoscopy or other imaging tests like a CT scan or MRI to get a clearer picture of what's going on inside your colon and rule out any serious conditions. Early detection is key, so don't hesitate to reach out to a healthcare professional if you have any concerns. Alright, let's talk about another type of stool that should never be ignored: black, tarry stools. Now, this isn't just about a change in color, it's about the consistency as well. We're talking about stools that are black, sticky, and almost tar-like in appearance. This type of stool can indicate bleeding in the upper gastrointestinal tract, such as the stomach or the small intestine. When blood from higher up in the digestive system makes its way down, it goes through a transformation. As the blood travels through the digestive tract, it gets broken down and digested, just like your food. This process changes the color of the blood from bright red to dark black. By the time it exits your body, it has that characteristic black, tarry appearance. So, what could cause bleeding in the upper GI tract? Well, one possibility is a stomach ulcer. Ulcers are sores that develop on the lining of the stomach, and they can bleed. Other potential causes include gastritis, which is inflammation of the stomach lining, and even certain medications like aspirin or ibuprofen that can irritate the stomach. Now, if you ever notice black, tarry stools, it's crucial to see a doctor immediately. This is considered a medical emergency, and prompt attention is essential. To determine the cause of the bleeding, your doctor might recommend an endoscopy. This procedure involves inserting a thin, flexible tube with a camera attached to it down your throat and into your stomach and small intestine. The camera allows the doctor to visually inspect the lining of your digestive tract and identify any ulcers, inflammation, or other sources of bleeding. Based on the findings, they can then recommend the appropriate treatment plan. Now let's shift gears a bit and talk about something we've all experienced at some point: diarrhea and constipation. We've all been there, right? Those days when you can't seem to get off the toilet, or those times when you're running to the bathroom every 5 minutes. While everyone experiences occasional bouts of diarrhea or constipation, it's when these issues become persistent or chronic that it becomes a concern. Let's start with diarrhea. Chronic diarrhea, meaning loose, watery stools that last for several weeks, could indicate an underlying issue. It could be something as simple as a viral infection or food poisoning, or it could signal something more serious. For instance, chronic diarrhea could be a symptom of conditions like Crohn's disease or irritable bowel syndrome. Crohn's disease is an inflammatory bowel disease that affects the lining of the digestive tract, while IBS is a common disorder that affects the large intestine. On the flip side, we have constipation, which is characterized by infrequent bowel movements or difficulty passing stools. Just like diarrhea, occasional constipation is normal, but persistent constipation could indicate an underlying problem. One possibility is a blockage in the digestive tract, but it could also be a sign of conditions that affect bowel function, such as hypothyroidism, which is an underactive thyroid gland, or certain neurological disorders, like Parkinson's disease. The key takeaway here is that both persistent diarrhea and constipation should never be ignored. They're your body's way of telling you that something's not quite right. If you're experiencing either of these issues, especially if they're accompanied by other symptoms like abdominal pain, bloating, blood in your stool, or unexplained weight loss, it's crucial to consult with a healthcare provider. All right, let's talk about one last warning sign that you shouldn't ignore: pale, greasy, or floating stools. Now, this one might seem a little strange, but trust me, it's just as important as the others. If you notice that your stool is unusually pale, almost clay-colored, or if it appears oily or greasy, it could indicate a problem with fat absorption in your digestive system. Our bodies need fat for energy and other essential functions, but we can only absorb it properly if our digestive system is working as it should. When something disrupts this process, fat can end up in your stool, giving it that pale, greasy appearance. So what could cause this malabsorption of fat? Well, several conditions could be responsible. One possibility is celiac disease, an autoimmune disorder where consuming gluten triggers an immune response that damages the lining of the small intestine, making it difficult to absorb nutrients, including fat. Another potential culprit is chronic pancreatitis, which is inflammation of the pancreas. The pancreas plays a crucial role in digestion by producing enzymes that help break down food, including fats. When the pancreas is inflamed, it may not produce enough enzymes, leading to poor fat absorption. A bile duct obstruction is another possibility. Bile, produced by the liver, helps break down fats. If the bile duct, which carries bile from the liver to the small intestine, becomes blocked, it can interfere with fat digestion and absorption. Now, you might be wondering why these stools often float. Well, it all comes down to density. Fat is less dense than water, so when there's excess fat in your stool, it can make it less dense overall, causing it to float. If you notice these changes in your stool, it's essential to see a doctor for further evaluation. They may conduct tests to assess your liver and pancreas function or check for malabsorption issues. So, there you have it. 5 warning signs that your poop might be trying to tell you something's not quite right. I know it's not the most glamorous topic, but it's an important one. Your poop is a valuable indicator of your overall health. Noticing changes like blood, unusual stool shape, or color can be early warning signs of more serious conditions. Don't ignore these signs. Consult a healthcare professional to ensure you're on the right track to maintaining your digestive health. Remember, early detection is key, and addressing these issues promptly can make a world of difference.